It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome to the Sam Lesante Show, folks. Our health shows continue. I'm here at the Health and Wellness Center in Hazleton. I keep telling you, they keep raising the bar all the time with health. We should be very proud to have the facilities that we have, health facilities we have here in Greater Hazleton area. Today, as I said, I'm here at the Health and Wellness Center, and I'm here with Catherine Avillion, and we're going to have some other people come on. But Catherine is the Director of Rehabilitation Services and Outpatient Rehabilitations. It's in charge of everybody here. Catherine, before we go on, tell us something about you.
Well, I'm an occupational therapist. I've been an occupational therapist for 21 years. It gives my age away. I've been with the Health Network for 16 years. So we've been here a long time at the Wellness Center. Prior to the Wellness Center being built, I was over at the old St. Joe's building. So I've been here a while, and I'm very proud to be part of this organization.
Well, it's a great organization to begin with. You've seen a lot of things happen in the last 16 years, in advances in technology, et cetera, for better health care. Is that correct?
Absolutely, absolutely. And we have state-of-the-art equipment here at the Health and Wellness Center, and top-notch therapists as well that have a variety of certifications in a number of different areas. And you're going to meet with some of them today so that they can tell you firsthand what they do and the great care that they provide to our patients.
Yeah, and it's evident because it just keeps on growing. I know the pandemic put things back a little bit because of the mask and exercising, but they're coming back. Once they're being able to understand what it's about and adjust to it, it becomes a way of life, I guess.
Absolutely. I mean, we want to do what's safe for our community, so we wear masks. We clean continuously after each patient, before each patient, making sure that we're providing a safe environment for our patients and our community to come for the health care that they need.
Now today, we're going to talk about some of the availabilities you have here. Absolutely. What areas are we going to be covering today? We're
going to be covering physical therapy, occupational therapy, and speech therapy. And within that, some of the therapists that you're going to meet today have some certifications. You will meet Joe Gosick. He's a physical therapist, and he is certified in orthopedics. You will meet Ashley Delbardo, and she is certified in pelvic floor therapy as well as concussion. You will meet Jen Holtz, who's certified in concussion therapy, and she's a traumatic brain injury specialist. And you'll meet our pediatric therapist, which is McKenna Schmidl. She is a speech therapist, and Georgette Herring, who is an occupational therapist. And that's just a few. We have.
Oh, I know you have a slew of them.
We could have you here all day.
There's a good question here. What are some of the most common reasons someone might need rehabilitation services, including cardiac rehab?
So for cardiac rehab, it could be a number of reasons. It could be a heart transplant, a heart attack, a stent, a valve replacement, something like that. They had a cardiac issue. They could be sent to cardiac rehab to be able to become healthier and to be monitored while they're doing that. For physical, occupational, and speech therapy, the diagnoses are far and wide. By and large, on an orthopedic standpoint, it could be they had a fracture, or they had a surgery for a torn ligament, or a sprain, a strain. They could have had a stroke. In pediatrics, it could be a developmental delay. There's just an endless list of reasons why people need to come and receive therapy services so that they can lead a better life.
How do you know when you should really make the call to your physician so they could schedule your appointment here?
So for anything, if you're not feeling well, absolutely you should follow up with your primary care physician. And it's the primary care physician who's well aware of everything we offer here. And they will make a referral for any one of the number of, things we have here in the rehab department to help their patients.
You do need a referral.
You do need a referral.
Now, my friends, you're looking at the biggest baby walking the face of the earth, okay? Today I'm here doing the show. When I'm done here, I'm going to get blood work, and then I'm coming back for an echocardiogram. It's my routine checkup. I do not like it, but I do it, okay? Because my wife says, you go out, you get it done. Sometimes we hear, I don't want to hear what they're going to tell me, or if you're not feeling well, etc. But I guess you just have to bite the bullet and just do what's right.
Absolutely. Being proactive is the way to go. I mean, we can catch things before they become a problem.
Yes.
And make their rehabilitation that much quicker and that much better. So being proactive and following up with your family care physician and going to your therapy appointments are going to be what gets you on the path to recovery and get you living like you're giving your life.
I like that. Now, my friends, before we go to break and we come back, we're going to interview the individual people. She mentioned we did a show on the cardiac. So if you go to YouTube and just Sam Lesante / LVH cardiac program, they explained everything in which he's talking about. It was a good show, and it tells them exactly what they do and how they take care of you. We're going to take a break right now. Welcome back to the Sam Lesante Show, folks. We're here at the Hazleton Health and Wellness Center, and we're talking about the rehabilitation services. You heard from Catherine Avillion, who is the Director of Rehabilitation Services. Now we have some of the individual people who work here, and I'm going to start off with Jennifer Holtz, right? Mm-hmm. And Jennifer, you're of the concussion and TBI therapy. Tell me what you specifically do.
I work specifically in speech therapy, so I see, our patients who've had a mild traumatic brain injury or concussion, or more moderate to severe head injuries, and we work on the cognitive components, including memory, attention, and reasoning skills, kind of bringing those back up to the level that they should be. But we also have services with occupational and physical therapy. Our occupational therapist focuses on the visual changes that happen with any kind of head injury. She uses a special system that we have called the VTS, and that works on getting the eyes to move more properly after head injury and getting them to work together again. And our physical therapist, she works on the balance component. A lot of the vestibular system is out of whack after a concussion. People have problems with balancing, loss of balance, they feel dizzy, nauseous, and she works on those things. She also has, a few special pieces of equipment, including the Balance Master, the NeuroCom, and a new system that we have, the Virtualis, which uses virtual reality to simulate real-world activities that she can address those balance concerns with.
So if someone, I always have the concern about concussion. Sometimes someone will fall and they don't know whether, what comprises a concussion?
A concussion happens with any blow to the head when there's injury to the brain that does not show up on any type of imaging. So really the difference between a concussion versus a moderate to severe TBI is whether or not, something shows up on a CAT scan or an MRI.
And speech therapy, tell me, maybe you don't mention the patient's name, but give me a synopsis of maybe a person who came in with something and what you did and how it came out for them.
Okay. Our typical patient with a concussion will come in, and their main complaints as far as, the speech therapy goes is they'll come in with complaints of, that brain fog. Like, I kind of feel foggy, I'm having a hard time focusing, I can't maintain my attention to things, I can't multitask anymore, I'm having trouble remembering things. And we focus on the memory and the attention, giving them some strategies to do, kind of exercising those portions of the brain and getting them built back up so that they can function
and
how
I'm
they
sure
were
you've
before.
seen some many successes here.
Yep.
That makes you feel good, doesn't it?
Absolutely.
Well, that's just part of what they do out here, my friends, and we're going to talk to some more people. Jennifer, thanks for coming on the show.
Thank you for having me.
Keep the good work up.
Thank you.
Now we have another person. My friend Joseph Gosek is the orthopedic therapist here, and of course orthopedics is a special favorite of mine because of my good friend Dr. Mead, who is a part of the Lehigh Valley Health Network. So tell me, orthopedic therapy, what exactly do you do, Joseph?
Okay. I'm a board-certified orthopedic clinical specialist. I primarily treat patients with back and neck pain, as well as anybody who may be post-operative. So if someone's had a hip or knee replacement or some type of shoulder surgery, I'm the person that they'll see to go through their rehab.
Okay, so do you have to have surgery before they come to you, or if you're having pain or uncomfortableness in your joints or whatever, can they still come and get a
So
referral?
we'll see the vast majority of our population is non-operative. Physical therapy is one of the first things you'll do if you're having hip, knee, shoulder, back pain, really any joint. You're going to come to see us first because we're one of the safest things you can do to help treat that problem before you start moving towards surgeries or things that may be a little more complex.
Okay, so I know a few people, friends of mine, who have knee problems, okay? And, sometimes they're hesitant for, going to get a replacement or whatever, or hip problems. What do you suggest for these people who are suffering with these particular pains right now?
Well, the first step is really to go see your family doctor, just to get a baseline, let them know what's going on, and see if they want you to come for physical therapy, because a lot of times a physical therapist, especially an orthopedic physical therapist like myself, is going to be able to take you through an evaluation, look at those joints specifically to see what's going on, how your joint's functioning, what may be causing the problem, and then we can help to develop a plan to get you going in the right direction to relieve that pain.
Okay. So sometimes if you're fearful of a surgery, which you shouldn't be, it would be advantageous for them to go to a physician and maybe suggest, do you think I could get therapy? I'm sure the doctor will tell them that or whatever, but it's a step in the right direction, correct?
Mm-hmm. Yep, it's a stepping stone. Even for people who are having surgery, sometimes the doctor will send them to us pre-operatively to help strengthen the muscles so that they'll recover better after their surgery.
That's good. So you've been doing all right up here, right?
Yeah.
Yeah. And how long you been here?
I've been a physical therapist with the Lehigh Valley Health Network for 6 years now.
Wow. And you're doing a good job.
Oh yeah, absolutely.
You're making people happy.
Yep. Every day we try to get people better. That's our goal here.
Okay, that's just one of many people who come up and giving therapy up here. We have some more people. Stay tuned. Now I'm joined by Georgette Herring and McKenna Schmidl, who are therapists up here. And so let me start with Georgette. Georgette, how are you?
I'm very good. Sammy, how are you?
No use complaining, I'll tell you. No one listens.
No one listens.
So tell me what you do here.
I'm an occupational therapist, so I work in adults, but I also work in pediatrics. The pediatrics side of it, we work with multiple disabilities as far as developmental delay, autism. We even work on some, if kiddos break their arms and things like that, we will also work with them there.
Okay, so how do I know if my child, because it's a lot of times, I don't think that he should be crawling or she should be crawling, or I'm a little concerned he doesn't respond or whatever. You get nervous, especially when you're a kid.
Yes. And as a parent, yes.
Yeah. So you're really looking in on that. How do you know when to make that call and say, let me just bring him up or her and check it out?
Where we would start at, we usually tell the parents to go to a pediatrician or a family doctor. A lot of times the doctor will see things like that. They'll see that the child, or they'll listen to the parents' concerns. They're not doing this or they're not doing this, and we will get an evaluation from the doctor or a script from the doctor. Okay,
so now, as any parent, no matter how old your child is, you're always concerned and worried. They should not panic, because that would be, your child's a little, oh my God, so you're always worried about that. How do we relieve that anxiety and let them know that there's a big light at the end of the tunnel?
Yes, we'll go over all the milestones that they should be hitting. We talk them through it. We'll give them a home exercise program. So you're exactly right. We try not to let the parents it's a lot. Yeah. It's a lot for the parents. So we try to work through with them to say, these are the steps we're going to take. This is how we're going to reach each of those steps.
And McKenna Schmidl, right? Okay, so what part are you doing in pediatrics?
So I am doing speech therapy. I work with children, again, like Georgette mentioned, with autism, developmental delay, but we also add in there some kids with articulation disorders. So they have
what's articulation?
I was unclear speech, so you can't understand what they're saying. As well as language disorders, so they have trouble labeling stuff or following directions, that type of thing.
So once again, a parent notices something about their child. What are some of the telltale things that you should be looking for?
So again, we would go to the pediatrician. The pediatrician would note some of those delayed milestones, and then they'd send them in for a referral, and they'd start with an evaluation here. Some of the telltale signs, I would say, one of the milestones is, saying some words by 1 year old, that type of thing. Some phrases by 2 years old. And we would go over that during the evaluation. We would go over every milestone, what's normal, what's the normal developmental.
So you both work together then?
Yes.
Yes. We try to work on to individualize each of the therapy programs for the children. Every child is unique. Every child is different, so we try to make it best to them.
Yeah, a lot of things happen here at this Delbardo. I mean, there's a lot of different areas. I'm learning a lot today. We were up here a while ago and did a show, but it just seems like everything just gets better and better, you know? Yeah. And so you've seen a lot of successes. That's the most important thing. People come in and they're nervous, particularly with a child, and, you know, you have to have that personality or, you know, the opportunity of saying, look, you know, let us work through this and things will happen, right? You work closely with the parents when you're...
Yes, the parents are allowed, and McKenna, you know, can also voice this as well, but the parents are allowed to sit in.
Oh, good.
We want them to be part of it. We also see progression too for the child when the parent sits out. You know, the children act different with their parents,
yes,
so
yeah.
sometimes, but we encourage the parents to sit in, get some of the home exercise program, and then we'll try to, you know, even set the parents out for a little bit and see how the child does alone.
McKenna and Georgette, right?
Yes.
I see that you really enjoy your work.
Yes.
And dealing with young people.
Too much,
you know.
I think.
Yeah.
Too much.
That's good. That's good. Well, I wish you the best, okay?
Thank you.
We're going to continue on interviewing people here. Okay, now I'm joined with Ashley Delbardo and also Taylor Haldeman. I said that right? Okay, let me start with you, Ashley. Ashley, tell me what you do here.
Yeah, so I recently became certified in women's health, also known as pelvic therapy. So if any of the women out there are experiencing urinary incontinence or pelvic pain, I'm able to see you for an evaluation and help you work through that and achieve your goals.
Okay, so here again, if someone's experiencing that, they have to go to their family physician to get a referral.
They can also go to their regular gynecologist or family physician, either one.
Okay, and the successes with that, I'm always interested in saying, you know, I know what you do, but you know, have you had people who give me an example of a person who had a problem and how you rectified it?
Right, so I had a case where the person was having some pain with urination. It turns out it was from foods and drinks they were taking in daily. So we eliminated some of those things, had great success. And another case, a woman was, you know, having some incontinence, needing pads daily. We've been able to achieve her not having to wear pads as frequently. So that helps them have a better quality of life.
So this is through therapy?
Through therapy, yes.
It's just amazing because there's a lot of things that, you know, you do here that people are suffering at home, and you have, well, I'm going to say I have all 100% of the answers, but you come close to it, right? Now, you're a hand therapist.
Yep, I'm an occupational therapist.
Okay, so tell me, what do you do to the hands?
So we work with a wide variety of diagnoses in occupational therapy. We see patients post-operatively, so patients who've had hand surgeries, elbow surgeries, and we also see patients who have chronic hand or elbow injuries as well.
All right, so what are some of the problems that arthritis?
So we do see arthritis, we see carpal tunnel, we see some tendonitis issues in the elbow, and we also treat MS, strokes, and a wide variety of other diagnoses as well.
Carpal tunnel, how are you doing with that?
What do we do to treat that?
Yeah, I mean...
So some patients come in post-operatively, so we work through a protocol that we have, or some patients don't have surgery or they don't want to have surgery just yet, so we work on treating them to help decrease their pain, improve their range of motion. We work on some strengthening techniques with them.
Yeah. So it's interesting. I mean, every field is interesting, and you know, we try to hit on all the facets of the body, and you know, you have the abilities here. What do you, any advice you have for women or?
A lot of women suffer from this, so if you are out there and having any issues with pelvic pain, pain with intercourse, or urinary incontinence, do see your doctor. There is help that you can get out there.
And in your case, Taylor, you have, if you know when you're having pain in your arm or your leg, or would deal with legs as well?
We do have a therapist. She's a lymphedema certified therapist. So with chronic swelling issues, she can certainly treat the upper extremity and the lower extremity for those with swelling.
You know, my friends, there's a lot more that people that are here. Well, thank you for coming on and explaining what you're doing here. Again, I tell people I'm the biggest baby walking the face of the earth. But however, you want to address things when you see them happening. So you got the recommendations of making you feel better, okay? Good luck to the both of you, and congratulations on what you're doing here. It's always a challenge, okay? Particularly these times, you know. We're going to take a break. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. You're watching our health shows, and believe me, we're learning a lot. Last show we did, we had a lot of people calling, responding to Dr. Mead and Dr. Martinez. We're here today at the Health and Wellness Center and talking to Catherine DeBillion, who is the chief person up here. She's the Director of Rehabilitation Services. You heard all the great things that they have to offer here. Okay, so how does one person, you know, be able to come up here? What is the process?
So if a patient if you're having an issue or a problem, you get seen by your primary care physician, they supply you with a referral for therapy, you can do two things. You can call our central scheduling number at 888-402-LVHN, or you can go online to your My LVHN account and you can self-schedule your appointment directly, which makes life so much easier. Well,
let me say this. Congratulations to all the people here. I have the
you.
greatest respect for healthcare workers, particularly today, what's happening in our society. I always had respect because my wife's a registered nurse, and you all do a great job. You're under a lot of different pressures and stuff like that, and yet Lehigh Valley Health Network has always responded with positiveness, and everyone has been great, you know. So I just want to applaud you for doing that.
Thank you. It was a pleasure talking to you today.
Okay. Folks, remember, don't hesitate. Be like me. I know I'm a baby, but I'm here today, and I'm gonna get blood work and get an echocardiogram and routine, just routine. Hopefully, it's only routine. The number is on the screen. We'll see you next time.
Thank you.